I've gone to the same hairstylist for the last 8 years, and now it's come to this. In this video, besides proving if I can cut my own hair, we're going to find out if coronavirus antibody testing is the key to ending social distancing. Welcome to another episode of Life Prescription. My name is Shri. Today, we're going to talk about antibody testing. Before we do that though, my haircut isn't too bad, right? Well, it's nowhere close to what my friend and hairstylist Miko Fan can do. Seeing him is one of the first things I'm going to be doing once it's safe to get a haircut. Sure, it's inconvenient for me to cut my own hair, but for Miko, his business is completely shut down. Right now, nearly 1 in 5 people are unemployed, and we haven't seen those kind of numbers since the Great Depression. In response, states have started to ease off on their social distancing policies. At the same time, the CDC has privately projected surges in coronavirus cases as a result. This internal document obtained by the New York Times shows projected deaths increasing exponentially through the month of May. Unfortunately, COVID-19 has been the #1 killer of Americans during the month of April, surpassing heart disease and cancer. As we talked about in the last episode, ending social distancing isn't going to be like a light switch that we turn on or off. It's going to happen in phases and should be guided by data. But what data do we have and what data do we need to safely roll back social distancing policies? That's what today's video is all about. And by the end, we're going to answer the following questions. Number 1, what is an antibody? 2, how can antibody testing help us understand how big the problem really is? And 3, are you immune to coronavirus if you have antibodies? You can find the timestamps for each section of this video in the description below. And if you find this video helpful, please make sure to share it with your friends and family. And make sure to hit the like button. It will help other people find this video. Starting off with our first question, what is an antibody? An antibody is a large Y-shaped protein made by cells of the immune system to fight off foreign pathogens like bacteria and viruses. They work by recognizing and latching onto a piece of the bacteria or virus. Once it's bound, the antibody stops the pathogen either by directly neutralizing it or by calling other immune cells to destroy it. We'll talk more if that happens with coronavirus later in this video. Now for our second question. How can antibody testing help us understand how big the problem really is? Because of a lack of testing, we still don't really know how many people are currently infected and how many people have been infected. There are 2 main ways of testing people. One way is to see if you're currently infected. To do this, you would swab your nose and check for viral particles. This is called a nasal swab PCR. Another way is through antibody testing, which means checking your blood to see if you've developed antibodies against the coronavirus. Let's take a look at what the results of these tests mean. Imagine if you got both the nasal swab PCR test and the antibody test done at the same time. When we take the results of these tests, there are 4 possible outcomes. If both tests come back as negative, that means you've never been exposed to coronavirus and are not infected. If the nasal swab is positive and the antibody test is negative, that means you are currently infected. It also means you are early into the infection process and it's too soon for your immune system to have developed antibodies. If both tests are positive, you have detectable viral particles and you have developed antibodies. In this scenario, it's not exactly clear if you're still infected or just contagious and shedding. I've encountered this scenario a few times in the hospital where a patient has a positive nasal swab weeks after their symptoms of cough and fever have gone away. In the last scenario, you are only antibody positive. This means you've been exposed in the past and are currently neither infected nor contagious. Now that we know what these tests do, how can they help us understand how much COVID-19 is out there? If we did mass antibody testing, we could get a sense of the total number of people who have been infected, because those people would have antibodies in their blood. This kind of testing is happening right now in certain parts of the country, and it's already changing what we know about this virus. As of the making of this video, we have about 1.5 million confirmed cases here in the United States. And those are by nasal swab PCR. Based on the antibody studies that have been performed, some estimate we may be off by a factor of 10 or more. If that's the case, the actual number of infections could be around 15 million. Knowing the true number of cases that we've had is crucial information. It would help us know where the virus has been, how quickly it spreads, and how dangerous it really is. Here in the United States, the information we have is limited, and the conclusions we're able to draw are based on that information. Now to our last question. Are you immune if you have antibodies? As of right now, we know that people likely develop antibodies after infection, but we don't know if those antibodies actually protect you or how long they last in your blood. This virus is completely new, and all of the information we have about it has been collected over the last few months. So it'll be some time before we understand if antibodies will provide protection. But if having antibodies means you're protected, and if enough people had antibodies, then we'd have what's called herd immunity. Herd immunity means that enough people within a population are immune, which protects people who are not immune, since the virus can't spread as effectively across a population. However, to reach herd immunity, we would need about 70% of all Americans to have been infected. Well, as of the making of this video, we have about 1.5 million confirmed cases, and as we said earlier, that could be an underestimate by about a factor of 10. So let's say there have been about 15 million cases. If you do the math, 70% of the US population is around 200 million. So we need about 50 times more infections than we have now to reach herd immunity. Imagine the amount of people who have had to go to the hospital and people dying with the numbers that we have now. Then multiply that by 50. Yeah, that's not something I want to think about right now. Hearing that, it makes sense why people in the scientific and medical communities are very concerned with getting rid of social distancing policies altogether with no real plan. But we're getting ahead of ourselves. We still don't know what having antibodies could mean. So let's talk about some possible scenarios. This is based on Twitter user Kira Newman, MD PhD's amazing breakdown. In the best possible scenario, the body develops the ability to completely prevent getting reinfected. This would be amazing because if you had antibodies, you could go about your normal life without worrying about getting sick. In the next best scenario, you can get infected a second time with coronavirus, but this time the virus is not as efficient as the first time. That would mean that you wouldn't get as sick and that you couldn't spread the disease as easily. This is still a pretty good outcome. In the third scenario, you can get infected a second time. In this case, the virus is efficient in making more copies of itself. But for you, the symptoms aren't as severe. This would be good for individuals since their illness wouldn't be as severe and we wouldn't be seeing hospitals get overwhelmed. In the last scenario, you can get infected a second time and the severity is the same. It's not so good for individuals. However, the immune response would limit the production of infectious viral particles, which would be helpful for public health, but again, not so much for you. In conclusion, it's still early days for antibody testing, but it's already reshaped how we're thinking about this virus. It's helping us understand how many possible infections we have missed, and the ongoing studies will show us if having antibodies makes us immune. If it seems like every day there's something new or people are just making it up as they go along, you're actually right. All of this is new. The virus has only existed in humans for the last few months, and the things we know about it are because of the work of scientists and researchers all over the world. Almost everyone in science and medicine is focused on one thing right now, and that's how to beat this virus. That gives me hope that every day we're closer to getting back to normal without having to live in fear. Thanks for continuing to learn with me as we navigate these uncertain times together. Until next time, stay safe, stay well, and I will see you soon.